Design and Entrepreneurship Alliance. And for those of you that aren't familiar with it, I see a lot of familiar faces. We just wanted to share a little bit about that organization and a little bit of an advertisement for our upcoming meeting. And then we'll get right into two snapshots from people that recently presented at the previous BME IDEA meeting, Lyn Denend and Aaron Kyle. So Sabia, next slide. So the agenda here, what is BME IDEA? Just a minute or two on this, and then we're going to go into these two snapshots and hopefully have some nice discussion. Okay, so we have access to our website, and we'll share these slides so you can access kind of the organization. And the goal of our organization is to really empower and connect design educators in biomedical engineering. Next slide. The history of the organization is really fantastic. And so we've been around now for over 20 years, organized by a lot of the leaders that we see in sort of the innovation in biomedical engineering and entrepreneurship space. Paul Yock, Paul King, Christine Korihara, Phil Wallerstein, who we know from VentureWell, and Jack Linehan. Keep going. And really that has kind of evolved into this organization of over 100 faculty and staff from universities across the US and internationally who are focused on health technology innovation in their undergrad, grad, or postgrad training programs. And this organization really focuses on bringing together the community to discuss common challenges and brainstorms new directions in BME innovation education. The organization itself had been meeting approximately every year or every other year before the BMES annual meeting, and we'll be doing the same for the upcoming meeting in Orlando. Next. And I just, again, want to kind of emphasize that why we're all really proud to be a part of this organization is because the wonderful community that we bring together with this shared interest of providing the best education for our students in the area of innovation, design, and entrepreneurship. And so a lot of wonderful sharing. We can kind of refer to this as a community of practice. A lot of things. I know every meeting I go to, I learn a lot from the individuals in the room. Next. And again, here's some of the examples of the meetings that we've had over the years. And I know several of you have attended those, but it's been a nice, long, and rich history. Next. And really what's awesome about this community, it's also very international. And I know Lyn and others have really been actively engaged with a lot of these organizations, but there is kind of a whole group that's biodesign focused in Asia and South America, and a lot of, and in Europe as well. And so we have really the chance to meet people from across the globe that have this similar interest of education in BME design. Next. And so lastly, again, just emphasizing the main goals of the organization is to learn and share with one another some best practices in how we're doing this teaching, and also connecting and networking with other BME design educators. Next. And so now I'm going to hand it over to Sabia, who's going to talk a little bit about sort of our flagship event, which is our annual meeting. Sabia?
Yeah, thanks so much, Katie, for the nice overview. So we have a great program lined up. For those of you that are not aware, we have a save the date here. So this is going to be October 21st, 11 a.m. to 6 p.m. Eastern. It's going to be in Orlando. This is where BMES is taking place in the University of Central Florida, which, just a minor note, that is not where BMES is. BMES is going to be in a different location. So this is going to be at the university. And registration is opening up later this month. So check out VentureWell's website. We will be sending out information on that and posting on LinkedIn soon. So just to mark your calendars, we hope to see everyone there. As Katie said, it's a great, it's a very warm experience. I feel like I'm new to the BME idea scene, but every time I go, I go back with great energy and inspiration. So speaking of the meeting, we are in the planning stages now, and this is kind of the draft agenda we have. Because it's a community, and one of the highlights of this group is the networking and the people that come together. So we are going to set aside some time for that. We're going to have a ever popular snapshots section where folks get to quickly discuss what they've tried out maybe in their classes, in their design classes, and share and kind of rapid fire style. And folks can maybe ask a question or two. And then really I would say the focus of the meeting this year is AI and design education. I feel like it's at the top of everyone's list right now in terms of, and I think Joe, we were talking earlier, you mentioned that. So I think we're going to be having some working sessions dedicated to this. And so a little bit more on that in a bit. And then we'll have a panel, hopefully summarizing a lot of the themes of the meeting, and then a closing, and then again another opportunity for folks to chat, to get to know one another, and who knows, have some collaborations even that follow. So if the snapshot idea, an opportunity to kind of share something you're trying out or you've done in your classes or university or program seems interesting, look out for that BME idea registration information that's coming out soon. Sorry. There's going to be some information there on how to apply for a snapshot. And then also for the working session idea, the way this is going to work is if you have some sort of idea that you're trying out and you just want some additional feedback, this is an opportunity to get that. So again, we'll have that information in the registration where you can apply to have a working session. Again, this is going to be all AI focused. And so the snapshots, just a quick note, open to all ideas, working sessions focused on AI. So this is something new that we're trying this year, but we figure with the times, this is probably going to be relevant for a lot of us. So that registration form is coming out later this month. We will be selecting submissions during the summer, and we'll be letting you know by August whether you're selected. We love to have many members of the community present. That's how the community grows and everyone benefits. So please do consider applying. Then just a quick shout out to the BME Grad Podcast. For those of you that have maybe recently graduated BME students that are just looking for additional insights on what to do with their career, professional development, there's a great BME Grad Podcast. It's hosted by Devin Hubbard, and it's kind of led by UNC Chapel Hill and NC State University. So the QR code is there. There are bi-weekly episodes. And so I think that the students will find something meaningful from it as they approach these next steps in their career. So please do check that out. And that's all we have. All right, Lyn, go ahead. So Lyn is the Director of Academic Programs at Standford Biodesign. And, or is that right?
That is correct.
And a lecturer in the School of Medicine at Stanford.
Yes.
And she's a historical part of BME Idea as well. So, and just, does amazing work. So I'm going to turn it over to Lyn.
Well, good morning, everyone. And my colleague Ross Hook is here as well. Hello, Ross. So I'm going to be talking a little bit about what we call community-based immersion. Well, please stop me at any time, especially since we're a small group. I'd love to have questions along the way if you've got them. Otherwise, I'll just kind of give a quick overview and then maybe we can have some discussion. So as many of you know, in sort of our design-oriented health technology innovation courses, clinical immersion has become sort of a best practice, right? Giving students the opportunity to go out into clinical spaces and see problems in the real world for themselves has become sort of foundational to many of the programs that we offer. The challenge, as we all know, is that there is a lot of administrative and bureaucratic hurdles to orchestrating clinical immersion. But even more importantly, perhaps, things are sort of shifting around us. And historically, clinical immersion has largely been conducted, in these hospital and clinic settings, which has a wonderful effect of getting many students really excited about, healthcare delivery. But it has a little bit of an unintentional, I think, bias towards pointing them at solving unmet needs for populations that access, right, traditional care settings and are sort of, in the healthcare system. However, as we're seeing more and more, up to 80% of the drivers influencing health outcomes happen outside of formal healthcare settings. The other thing that we do, actually, Ross and I like to say, we're sort of doing our best work when we're trying to keep up with our students. And, what we were seeing sort of in our classes is that more and more of our students and our trainees were becoming interested in leveraging technology innovation to really improve not just healthcare outcomes, but healthcare access, as well as, outcomes for people, again, who aren't in these traditional healthcare settings. And so this got us thinking about alternatives to sort of this, traditional clinical immersion. The initiative that we came up with and began piloting in our full-time fellowship, which we can use as a little bit of a learning laboratory, is to experiment with what we called community immersion. And so the whole focus of this effort was to focus on broadening the immersion experience beyond solely clinical facilities to include community-based organizations where our learners could sort of spend time with and build increased empathy for populations that are traditionally underserved by the healthcare system. This may include people who are under or uninsured. We also wanted to provide them with the opportunity to, identify needs that you might not see, right, in the traditional hospital setting, and then also give them a better understanding and a greater consideration for this notion of the whole patient. So not just what's happening when that patient is sitting in front of the doctor or other care provider, but what happens when that person, is at home or at work or in the community, so that they could have a better understanding of sort of what happens, upstream and downstream of the care interaction. So the way that we structured the initial pilot, so in our full-time fellowship, our fellows spend about a month doing clinical immersion. And so what we said is, let's take one of those weeks, 1 week out of 4, and send them not to the hospital, but to the community-based spaces. Our clinical focus area for the year that we did the pilot was in PM&R, pain medicine, and substance abuse disorders, which is very ripe for community-based immersion. And what we thought would be most effective is to focus on immersion versus observation. Often in community spaces, you can create a lot of discomfort with this notion of observers, standing back with notebooks, taking notes about what's going on around them. There can be this perception of being, observed and judged in the process. And so we thought, well, let's figure out how we can immerse rather than simply observe, to create hopefully lower barriers and make sure that the community-based folks that we're interacting with feel comfortable with the fellows' presence. So given our theme, what we did is we forged some partnerships with organizations like the ones you see here, Support for Families, which is focused on children with disabilities, the ARC, which was adults with neurodevelopmental delays and disabilities, the Bridge Clinic, which is substance use disorder consultations and care, and then Glide, which is a well-known organization in San Francisco, which focuses on serving the needs of the unhoused community. And so you can sort of see the types of activities that the fellows engaged with these different organizations. And here are a couple of photos of them, out there in the community doing their thing, or before and after doing their thing. So really at the, and as I said, full disclaimer here, we did not conduct a rigorous study around this, but we did do a follow-up survey with the fellows after their immersion. And we were heartened to see that 100%, so 12 out of 12, small sample size, indicated that they thought it was extremely important for community immersion to become an enduring part of the fellowship need-finding experience. And then a qualitative assessment of the needs that they brought back with them did show that they had a more well-rounded set of unmet needs that they were interested in addressing. So rather than just all being, sort of hospital-based or traditional doctor, nurse, other care provider driven, We saw needs that reflected, the challenges of people who are marginalized, suffer from stigmatizing issues, or directly affected by the social determinants of health. And really was great to see at the end of that nearly year-long fellowship experience that one of the community-based needs related to cerebral palsy and spasticity became a final project that is actually still moving forward today, a couple years after the fellowship. So just a few more quick things to share before we start discussion. I won't read these to you, but you can see a few quotes, qualitative quotes from the fellows from their written surveys, identifying, sort of the positive things like, breaking down problems that previously felt unsolvable, understanding, what was happening to people before they ended up in the ED and what their realities might look like afterwards. And then an appreciation of how much the important role that trust plays in the delivery of healthcare. And then we got quite a bit of constructive feedback that was very, very helpful in helping us think about how to evolve the pilot. So spreading this out, it was very intense. And we ended up being in spaces where that were heavily male dominated. And so that being an opportunity as well to make sure things were more well-rounded. So just a few lessons learned, kind of the key themes that we sort of took away that hopefully can be helpful to others is that building these community partners takes substantial time and energy. So we had one member of our team over a series of several months who did the outreach to these community-based partners and sort of, it took time to sort of help them understand, who we were, what we were working on, why we wanted access to the environment, what that was going to be like for their folks. And then also very importantly, how could we make this mutually beneficial? Whenever we're in community-based spaces, we want to be careful, right, that we're not being extractive, that we're being hopefully mutually helpful. And so there was some, negotiation with these partners in terms of how could we provide services or in-kind support, or in some cases, monetary remuneration. Some places were like, hey, show up with food and our people are going to be delighted, right, to sit and talk with you. In other places, it was like, well, we can help you, gain access to these spaces, but could you make a donation to our organization? Or, well, yes, come, but we're going to put you to work, right? So wanting to find ways to add value to the interaction from their perspective. We also really, I think maybe underestimated how different it might be for students to immerse in community environments. Our trainees in our fellowship are postgraduate folks with work experience, and even still, some had never been in spaces interacting with people who are unhoused or wrestling with substance abuse or, very untrustworthy of the healthcare system. And, it was emotional and it was intense. And so we really learned the importance not only of preparing them for these interactions, but also debriefing afterwards and also making sure that there were protocols for safety, especially if you're, dealing with folks who may be a little bit unpredictable. We needed to have procedures and protocols about what would happen if something were to go wrong, though there were no significant incidents, happily. And then also just being thoughtful about sequencing and pacing. So trying to do a bunch of these experiences back to back to back in, a short period of time really sort of became a little bit emotionally, I think, taxing for some people. And so in future iterations of this, we've learned that there's some benefit to spreading these interactions out a little bit more and mixing them in with the other types of immersion that we're doing. So key takeaways are that, that we believe that this pilot suggests that community immersion has value in broadening the sorts of unmet needs that students identify and potentially pursue as projects. it's certainly played a key role in terms of promoting increased empathy and understanding of the sort of whole patient and their lived experience, beyond, on both sides of that, clinical interactions. And then also sort of, putting unmet needs in context for people. And so we would like to assert that can be an enriching addition to traditional community clinical immersion. And if you're interested, this QR code will take you to a teaching tips article that we submitted to Biomedical Engineering Education. You can learn a little bit more about the program.
Cool. Thanks so much, Lyn, for the presentation. Really outstanding work, and really appreciate you sharing with all of us. So now we're going to transition to Aaron, and who's going to talk about a little bit how he's engaging his community. Aaron.
Thank you so much. It's hard to follow up Lyn. I'm going to do my best here. Hi, everybody. For those I've not met, my name is Aaron Kyle. I'm a professor of practice in biomedical engineering at Duke University. And I am the director of a program called Outreach Design Education, where we focus on improving K through 12 STEM education and knowledge, largely through engineering design. And what I'm going to talk to you all about today is a focus on the efforts that we make to engage with local teachers to develop design-centric content that they can take back to their home schools. And the reason why I want to share this with you all is because I have this vision for educators like ourselves working in partnership with our various communities to broaden out participation in STEM learning. The real kind of grand vision that motivates the work that we do within ODE is having middle and high school students learn about STEM with the goal of improving these students' STEM identity. What we talk about when we refer to identity is this idea of younger people feeling like they are contributors to the STEM community, that they have persistence, and that they are ultimately people that belong in our sciences and engineering. Now, this is important for a number of different reasons, but what we oftentimes find is that there are challenges to younger people forming STEM identity. And if you go through the literature, it largely boils down to these four main points. Overarching interest and engagement with STEM can be a major issue or an inhibitor to people pursuing these opportunities. Like I said, this early formation of identity, right? Really feeling like you are a scientist or engineer. There are also issues with regards to access to nutritious and robust programming within STEM outside of what might show up in the normal classroom. And finally, with these motivations to have more younger people engage in science and engineering, we see that there can be deficits with regards to teacher preparation. And all these things kind of come together to kind of be inhibitory towards younger people's engagement with the sciences, with engineering. Now, besides the fact that this is just kind of basally important for our society on the whole, we find that there's an increasing need for a STEM adept populace. According to the Bureau of Labor Statistics, there's an estimate that by 2033, there will be an increase in 10% in STEM jobs. And this will take place across a variety of fields, like what we think about in terms of science and engineering research, all the way through biomanufacturing and jobs that might not require higher level degrees. So it's reasonable to assume that in order for us to have a populace that will be able to fill these new roles, we need younger people right now to be as engaged in science and engineering as possible. And that comes largely through early formation of STEM identity. This speaks to the work we do in outreach design education. So ODE, as I like to call it, brings engineering design to middle and high school students with the goal of empowering them to find and solve real-world problems while developing persistence, belonging, and their sense of scientific contribution, all of the hallmarks that go into forming a STEM identity. So I will belabor this one, right? We're all very familiar with what we consider the biodesign process. But I share this with you all to give us all the kind of equal foundation of what we're talking about when we refer to design education. And working with younger students and community partners, what we largely focus on is this idea that design involves being able to identify when something is wrong, being able to devise prospective solutions to that problem, and be able to invent solutions that will address the problem and do this in an iterative nature. So this is kind of the foundation for everything that we do within ODE. Interestingly, over the years, the teachers and the students that I've worked with have come up with what I would argue are quite refined and better versions than what I share with this process here. So it shows that you can share design thinking with a variety of different populaces and have it be something that gets improved upon. ODE is a constellation of 3 interconnected programs, all undergirded by engineering design thinking. We work with middle school students by our hackathon, in which we have grade 7th and 8th grade students come to campus and learn about engineering design. But the things that I really want to focus on for today are these bottom 2 elements, our high school summer design camp, and the engineering design curricula that we develop with middle and high school teachers. So our summer design camp is our most intensive effort. This is a non-residential program that takes place for 5 weeks each summer on Duke's West campus. And what we do during the summer design camp is that we invite local rising 10th, 11th, and 12th graders to the program, in which they are being introduced to the biodesign process, as well as developing technical competencies as far as like Arduino programming and doing some basics of CAD using Onshape, and being able to work with our rapid prototyping tools like our 3D printers and our laser cutters. In parallel with being introduced to the engineering design process, our students are charged with uncovering some biomedical need. A lot of these needs are kind of predefined. I share with them a listing of projects I've seen over the years teaching this program and teaching capstone design at my various institutions, but it's still ultimately the students' call what project they want to work on. We spend the first 2 weeks introducing biodesign and the last 3 weeks doing low to medium fidelity prototyping on their solutions to the problems that they have uncovered. So what you see in the short video on the right is an example of one of our student projects from the 2025 year. These students are working on a problem associated with people that use guide assistant canes being susceptible to above the waist injuries. So they adapted a cane to be able to have these ultrasonic sensors that will be able to detect obstacles both above and below the waist to navigate environments. And this speaks to the sort of work that we're trying to do in ODE, kind of turning the lot of the technical competencies that go into design projects on their head. Starting off with the problem and letting that be the thing that leads to the students being excited and engaged in the development of a solution. So these students were using microcontroller programming, they were using acoustical principles and ultrasonic pulse echo technology, all in efforts to solve this problem that they had identified. In parallel with us working with students over the summer, we invite local teachers to be able to receive the design process in parallel with our students. So we use the summer design camp as a co-design or co-learning environment for local middle and high school teachers. The idea being that many of the teachers we recruit and work with have little to no engineering experience, but there is increased motivation to bring engineering and specifically engineering design into their classrooms. Our North Carolina science standards and many science standards for K through 12 education throughout the country require some degree of engineering and design. So the teachers are learning the design process in parallel with the students. And the way this works out is that on Mondays through Thursdays, we focus on our time with students, while on Fridays, we spend our time devoted to our teacher partners. And we spend the entire days on Fridays reviewing the engineering design process and starting to develop models or lessons that we can take back to their home school in order to provide design-centric instruction. So what you see on the left there is one of our teacher partners from this past summer joining us for the summer program. In the center is an example of the projects manifesting from teachers who had worked with us to develop design-centric content for their home school. This was one of our middle school partner teachers who had her students work on projects related to the sanitation and maintenance of a restroom near their classroom. And what the students identified was an issue with paper towel dispensers and then being depleted without being replenished by their custodial staff. So this team developed this optical monitoring system that would use basically like a light curtain to detect when the paper towels had been depleted and to trigger alarms to custodial staff to provide replacements. Additionally, we emphasize dissemination and sharing out of our lesson plans. What you see on the right there is a plan that we published in 2025 in tryengineering.org, which is a repository of engineering and engineering design lessons that are sanctioned by the IEEE. So we developed this lesson plan with one of our high school teacher partners that is focused on kind of optimization of yeast and fermentation processes. And she took this basic chemistry lesson and adapted it to be more engineering design focused. So over approximately 10 years of doing these collaborations with teachers, we've kind of converged towards a couple of different models for engaging teachers and bringing engineering design back into the classroom. I call these the content integrated course or the pure design courses. And the common elements between both of these approaches is that they involve introducing students to engineering design and utilizing design principles to engage in hands-on projects to solve problems, oftentimes of their own identification. In the content integrated model, we're usually taking a look at some existing class and using it as a framework for, or using it as an opportunity to introduce design thinking. So we might take a physics class and make it more applied physics, working on projects like a mousetrap car and involving design inputs or guiding principles that might lead to better designs or more iterative approaches to the students developing solutions. On the pure design course side of our models, that is when there's a lot of curricular flexibility. Teacher might have an opportunity to bring in an elective course or a completely different module into their curriculum and really be able to teach or engage in a full design experience for their students. So the pure design course can look more like what we do during our summer program. It can be something that is really surrounding the engineering design process and having students be able to define needs, develop solutions, prototype solutions, and iterate with the appropriate amount of flexibility and freedom within the class. Either way it goes, we work on these approaches in coordination with our teachers to figure out what is best in terms of their students and outcomes. So I'm not going to share too much data in this presentation, in large part because I'm going to be giving a talk on this stuff in more detail at ASWE in a couple of weeks, and I'll link to you all to the paper that goes on it. That's a nice explanation. The more truthful explanation is that I got to put my slides together, so the data needs to come together in that way anyway. But just to share with you a little bit about what this looks like, what you're seeing in the image on the left here is a photograph of the 3 teachers we worked with this past year. The 2 on the bottom row there, they're both middle school teachers, or actually all 3 of our teachers last year were all middle school teachers working in Durham Public and Orange County schools here in North Carolina. And what we did in working in coordination with these teachers is kind of combinations of both the pure design course and the content integrated model. So the teacher you see on the right there, Miss Christy Mabry, her school district is becoming heavily focused on bringing design thinking into their K through 12 curriculum. So what we've been able to do is to share our design frameworks throughout Orange County schools, and it's manifesting in lessons taking place from their K through 12 levels. So what they did recently is that they had a multi-school design challenge where basically all of their middle and high schools and even a couple of their elementary schools in Orange County had engaged in some sort of engineering design project related to the design of a new school that was going to be joining their district here. And what you see in my middle image there is that they're going through their simplified version of the design process, but it's appropriate for their students as they were engaging in this design thinking. What you see on the bottom right there is one of the models that came out of this design project. I was fortunate to be able to go to their final design challenge about a month back now. And what you're seeing there is the product of a project that was developed not by high schoolers, not by middle schoolers, by a group of 6th grade young engineers who were envisioning a green learning space for this new school here. And what you're seeing is their model of that learning space. This was a super cool experience. Being kind of selfish here, they even had a group of kindergartners that presented some of their design thinking work. And there are a few things cuter than a bunch of 6-year-olds talking about design projects there. And now I got to be careful because I'm going to end up teaching design to elementary school or kindergartners if I keep going at the current pace. So that's an example of how the design thinking is broadening out across an entire curriculum within a district. What you're seeing in this slide here is the product of our teacher in the center here. This is Mr. Wilman Enriquez, and he teaches a seventh grade after school STEM program for students at his school. And he uses design thinking to kind of frame up the various projects that his students work on. So given that our summer program is largely biomedically focused, he has his projects or his students work on projects that are biomedical as well. So what you're seeing in that center short video here is their early prototype of a pill dispensing system. And while it might look like a pretty ugly prototype, I think this thing is beautiful, right? They actually 3D printed this they designed and 3D printed the enclosure. They wrote up the Arduino code that was going to be able to execute this. I don't have the audio going on, but they had an audio alarm going on. So this was meant to be a reminder for people that have memory issues when they are meant to take their medications. On the right there, that was a student team that had done some research and learned that there are actually a surprising number of people that are driving that have red-green color blindness, and the color of stoplights don't necessarily mean a lot, although the sequence is useful. So they wanted to do create an adapter or an add-on to conventional stoplights that would make it possible for people with color blindness to be able to better navigate what was going on. So once again, a group of seventh graders really using what we do as university educators to be able to really translate their interest into problem definitions, prospective solutions, and prototypes. So summarizing here, the sorts of things that work, and again, I'm not trying to proselytize anyone. I just like to try to share that we can do this sort of thing and share our expertise and knowledge with our local communities. As Lyn was mentioning, right, strong local partners are the key to doing this sort of work effectively. I'm very fortunate to work with school districts around here and teachers and administrators that are very receptive to this sort of thing and are supportive both of our programs and our research. When I speak to community building here, it is talking about outside of the university, but it's also the teachers that I work with, right? By working with various teachers over the years and keeping them involved with our work, we've got this cohort of fellow educators that are familiar, that are building upon their prior experiences. As I mentioned earlier, we're focusing increasingly on dissemination and lesson planning, right? We don't want this to be restricted to Duke University and the Triangle, right? We want people all over the place to be able to implement these lessons. And finally, and obviously, funding helps, right? Whether it's federal funding or private funding, it's important to have support to be able to do this sort of work. This work is not without its challenges, right? For me, it's a big commitment. I ask teachers to work with me for 5 weeks over the summer and to develop and implement these materials in the subsequent academic year. So recruitment can be challenging. You really do have to have a good feel for what's going on in the classroom in terms of curricula, how much flexibility is there. Teachers are overburdened, right? And we want to make sure that this is something that is complementary, not just something else that they have to do. And finally, there are sustainability questions, right? How do you make sure that the lessons that you develop don't go away when a teacher decides to change schools, for example, but they persist from one place to another? So there are certainly issues that arise with this sort of work, but it is very, very fulfilling. And I think it's kind of the next step of what we can do as design educators in terms of supporting the STEM learning, not only for our undergrads and our grad students, but for our pre-college students as well. So thank you all for your time. If you'd like to get in touch with me, here's my contact information. The QR code there will take you to my ASEE paper, and I'm going to be presenting in quite a bit more detail about this at ASEE in a couple of weeks, as well as going over some of the data that I'm not just making it up, that this is an effective way to go about engaging younger people. So thank you all so much.
Thanks, Aaron. That was really outstanding.